Disclaimer, I am not a doctor. This is not medical advice. This video is for educational and entertainment purposes only. I don't condone the use of performance-enhancing drugs. Drugs are bad, okay? On with the video. Today, I reveal everything that happened while I took TRT for 3 years. Gains, side effects, and the other things that no one really talks about. TRT, Testosterone Replacement Therapy, has grown in popularity over the years for people seeking the extra oomph in the gym or for those who have a legit medical need for it. Was it worth it for me? And is this something you should ever consider doing? Back in 2021, I was drained from weight training in my 1-year crash diet trying to lose fat from 218 pounds. In conjunction with taking 20 milligram edibles every night for sleep. I was dazed, confused, and desperate. I was only seeking TRT to improve energy. Muscle gains were not really my main objective here. The online clinic I used, named Peter MD, confirmed that my testosterone levels were low, around the low 200s. So with this, I had high hopes to regain some energy here. I decided to try prescription TRT injections. Testosterone cypionate was what I was prescribed, alongside with HCG to keep my natural T production active and my family jewels from shrinking. My starting dose was at 160 milligrams a week, 80 milligram injections every 3 days, and HCG 50 units a week. Intramuscular injections in my glute medius were the preferred, least painful way to inject. It was a new weird feeling injecting something. Almost felt illegal, knowing I was giving up my natty status. Honestly, I wasn't sure what to expect, yet I was hoping for the best with this. After the first 4 weeks of TRT, changes were very subtle. It was slightly more energy, more acne like a teenager again, and more facial hair than I've ever had in my 30 years of living. However, my calorie deficit and THC consumption was still a big issue. Strength was maintained while on the deficit. Drive was still low. Libido, luckily, was still there. Most days I felt bad. Other days, the mood swings hit so hard I wanted to give up. However, doctors reassured me that TRT is a slow-acting medicine. It can take a little longer for some people to see results they're looking for. So about 4 to 6 months into TRT, my crash diet was over. I successfully lost a ton of body fat, weighing in at 170 pounds. I noticed a slight increase in appetite after my dieting phase was over, like I was going through puberty again. I also thought my energy levels were going to pick up again since my dieting phase was over. One problem though, I was still taking edibles every night for sleep, waking up with a frickin' hangover every morning. To mitigate this, I supplemented with loads of caffeine, and that's how I got through most days. Actually, that's an understatement. Every day I was supplementing with loads of caffeine, 500 plus milligrams. I felt like a solid 5 or 6 out of 10. After a 3-month blood work follow-up, my doctor shared with me that my testosterone levels were just right, around 1,000 nanograms a deciliter. Nothing else appeared to be wrong, with the exception of elevated red blood cells, which will happen when you do take TRT. He recommended to donate blood every so often, and my dose was also lowered to 140 milligrams per week to help me dial in a little more. HCG stayed the same. I knew something wasn't clicking though. I still felt like a sack of potatoes. It was definitely the nightly edibles wrecking my sleep. THC, by the way, kills REM sleep, the restorative part of your sleep. So if you take THC for sleep, bye-bye REM sleep. By 6 to 12 months, I noticed I looked more vascular. Also having a lower body fat helped with that. Needing to shave more, not much else. I was worried though I was going to lose my head hair early on. Fortunately, none of that fell out and I'm still rocking a full head of hair today. Look. Strength maintained, recovery was meh, and sleep was a distant dream. Was going through the motions every day, needing an IV drip of caffeine to function. I'm telling you, it was the THC, man. I was depending on it like a fiend for sleep. I was starting to see that TRT wasn't magic. Other lifestyle factors needed to be dialed in first, so I tried cutting down on my edible consumption. I remember how difficult it was to taper down super slow. I highly suspect my year-long crash diet did a number on my energy levels too. Refeeding myself after the diet felt like a no-brainer. Energy levels would pick up again, right? Not really. I was still under-recovering from working out so much and THC use, so I ate more, eating close to 3,600 calories per day. No matter how much I ate though, I honestly felt like energy levels still plateaued. The good thing about this though, I was getting stronger subtly. I noticed muscle was packing on again, as well as fat that I had worked so hard to get off. Before this got out of hand, I decided to enter another cutting phase, which got me to sub 10% body fat levels, absolutely shredded. Year 2 was when I hit my peak shredded levels after a 5-month cut, weighing in at 150 pounds. I had veins like a road map, super hollowed out cheeks, and the ravenous appetite of a bodybuilder coming out of prep. I still experience that same energy dip, anxiety, insomnia, no change in strength. Still had hair and libido, thank God. At this stage, my TRT experience showed an insane physical transformation. I absolutely loved the aesthetic, but I still felt like garbage. I still wanted to give the TRT more time to dial in, even though I knew deep down I should be stopping this. It was time I got serious about dialing in. I tried switching my injection schedules from every 3 days to every other day, and back again, with no success. I made an effort to cut back more on THC and caffeine, getting nutrition, workouts, and sleep under control. Unfortunately, being shredded and immersed in this influencer lifestyle made this next to impossible. I was so tired I needed caffeine to function, yet not tired enough to fall asleep, which was where the THC came in handy. I was walking 15,000 steps a day, working out balls to the wall, just to maintain weight. This soared my appetite even further. I was never full, always needing to eat something, always feeling on the brink of disaster. TRT became a lifestyle among all other substances consumed just to keep my head above water. Year 3 was the huge reality check. I realized TRT was not benefiting me. Something else needed to be done. I sought help from a dietitian to help get my life back on track. I was prescribed a meal plan to gain healthy weight back, around 3,500 calories, and discontinue all exercise. No problem. I ate in accordance with my meal plan, but didn't discontinue exercise. Obviously, this influencer lifestyle was more important. Also, being a personal trainer gave me a good excuse to stay active. So after 2 months of working with her, it was obvious to her I was not getting any better, probably getting worse. Insomniac, feeling ravenous 24/7, anxiety, hallucinations, no motivation, depersonalization. Yet I still found the energy to work out. I was at the bitter ends of an eating disorder. She highly recommended I admit to eating disorder residential treatment ASAP. While I was in residential treatment in January of 2025, I met with a team of healthcare professionals that advised TRT was making my symptoms worse. It could have played a part. I knew though that excessive dieting and exercise were the main culprits. I argued with them to keep me on because my hormones would just crash. It took some time for me to come to terms that it just was not a medication suited for me. I eventually agreed, and the doctors tapered me off of TRT and HCG without a post-cycle therapy protocol. There marks the end of the questionable 3-year TRT experience. In summary, here's how this 3-year experience was for me. The good: some muscle and strength gains, increased facial hair, no balding, insane looking photos, and a lot of compliments. The bad: no increase in energy, elevated blood markers, water retention, acne, insomnia, brain fog, fatigue, and injection burden. The unexpected: TRT was making my symptoms worse. If we look back at why I got on this in the first place, I was looking to increase my energy levels from crash dieting, not making TRT very effective. It only works if your other lifestyle factors are dialed in, which include your exercise, your nutrition, sleep, and your sex life. TRT just does not work the same for everyone, which I found out much later. Some people are hyper responders, while some don't respond much at all. My 2 cents for anyone considering TRT: again, I am not a doctor. Consult your healthcare professional first, but if you are considering TRT, here are a few things. 1, fix your lifestyle factors naturally before getting on TRT. This is a long-term commitment. If all else fails, contact a reputable clinic to get your levels checked. You may qualify for a prescription. 2, while on TRT, focus on nutrition with quality protein, carbs, and fats, exercise, weight train, and cardio, and quality sleep. Do not self-medicate for sleep. 3, be patient. Results aren't overnight. It can take anywhere from 1 to 3 months to see any noticeable change at first. And 4, TRT doses will not get you insanely jacked. If you go into it for that reason, you will be greatly disappointed, man. If you found this video honest and helpful, be glad that you learned something new today. I sure learned something new being my own lab rat for 3 years. Being natural again and near 100% recovered from my ED, I feel so much better physically and mentally. Overall, I could confidently be a true advocate for fitness without the use of polypharmacy. Thank you for sticking around to the end of the video. I know by now that you will make the right decision to do what's right for your health and your life. This is Justin Schrobeck Fitness. Stay balanced, stay natural, and I will see you all again soon. Peace.